Hello and happy Pride. I am Admiral Rachel Levine, and I have the honor of being the Assistant Secretary for Health at the United States Department of Health and Human Services and the head of the United States Public Health Service Commission Corps. And for our Pride event, I'm here with Dr. Jesse Ehrenfeld, and he is the president of the American Medical Association. Jesse and I have known each other for many years now, and we're friends and colleagues. And we're going to have a discussion.
Sounds great. Thanks for having me, Admiral. It's good to see you.
My pleasure. So I guess the first question would be, is there a specific LGBTQI plus medical issue, a medical topic that's really important to you?
Well, thanks for having me. It's great to be here representing the physicians of the nation as president of the AMA. For me, it's all about getting patients the care that they need that's personalized and preventive. And unfortunately, LGBTQI plus people are less likely to have a regular doctor or regular source of care compared to everybody else. And that means that they often forego preventive screenings. And the only way that people can get the care that they need that's personalized, that meets their needs, the needs of their families, is if we're honest with our practitioners, our physicians, our providers, our healthcare teams about your sexual orientation and gender identity status. So coming out to your doctor isn't just the right thing to do. It means that you get personalized care. And so that's an important issue that I think is important to share out with your listeners.
Well, thank you. Yes, personalized care, affirming care. So how can physicians and other medical providers provide just generally affirming care to LGBTQI plus people and their families?
Well, affirming care starts with being listened to and feeling heard. I'm a gay dad. My husband and I have got two beautiful boys. We've had experiences where, you start by filling out the paperwork, the form, and it asks for the mom and the dad. And that's not a very affirming approach to welcoming a family into a clinic or setting. We had a situation where we were actually at the dentist. And one of our boys wasn't exactly thrilled about being there. And the person at the dental office said, well, next time, why don't you have your wife bring your son in? Well, he doesn't have a mom. He has me. And so, when we make those assumptions in a healthcare context, it can be ostracizing. It can be hard for LGBTQ plus patients to, hear those words that make them feel like, they're not a part of the system, that they are excluded. So by making sure that we're inclusive through language and words and really listening and hearing who our patients are, everybody does better and gets the care that they need.
We all have had those difficult experiences, although I think that things are getting better. I think that the medical community has heard that message.
Things are getting much, much better, and I will tell you I'm very proud of the work that the AMA Foundation's done to support the nation's first LGBTQ plus health fellowships at a couple of medical schools across the country, bringing more competency to more and more physicians across the nation.
Health equity is really fundamental to everything that we're working on here at HHS, and I know you will work on through the AMA. And there are healthcare disparities in regards to LGBTQI plus individuals and their families. Why don't you talk about some of those health disparities?
Yeah, so unfortunately, if you are LGBTQI plus, you are more likely to live sicker and die younger. And that's because not of biology, not genetics. It's because of those upstream drivers, social determinants of care. It's more likely to not have health care access, more likely to not be insured, having difficulty getting regular employment or a safe place to live. So we need as a society to make sure that we start to address those foundational drivers of health, because that's what's going to solve these foundational health equity issues. What can we do as physicians? We need to make sure that our practices are inclusive, that they are affirming, and that we give the best personalized preventive care to every patient who walks in our door.
And I think that that's fundamental to what the AMA has been talking about. As you know, I've been a member of the AMA since I was a medical student back in the 80s, and really just it's wonderful what you and the current leadership have brought to the AMA and the work that they're doing doing to combat health disparities?
Well, we have a long-ranging, very aggressive strategic plan for elevating health equity. We launched a center in 2019 with the recruitment of a transformational leader, Dr. Letha Maybank, and we continue to fight each and every day to make sure that we're doing all of the work internally to make sure that we are prepared to support physicians across the nation to elevate health equity.
Well, as you know, we're entering Pride Month. It's so exciting. So for you and your family, what does Pride mean to you?
You know, for me, Pride is about amplifying the voice of the community. And, you know, I grew up in an era where I didn't know if I could ever be an out gay physician. I didn't see myself, you know, represented on TV or in leadership. And obviously the visibility that I've brought to the AMA through my role as the first gay president has been a really humbling opportunity. The visibility that you bring in your role as the Assistant Secretary is just phenomenal. And I hope that people who are out there listening see that it is possible to do great things and make important contributions to society, regardless of your sexual orientation and gender identity. And for me, that's what Pride's all about.
Well, you certainly have done this in your clinical work and your academic work, and as being the president of the AMA, I know you're coming to the end of your term, and but things will continue at the AMA and continue to make progress.
Well, I hope I can continue to find ways to make contributions beyond my time at the AMA, but obviously it's been the thrill of a lifetime.
Well, thank you very much, Jesse. So we've been here with Jesse Ehrenfeld, the president of the AMA, talking about Pride and LGBTQI plus health issues. So thank you very much for your attention. And remember, we are stronger together, and it's all about Pride.
Produced by the U.S. Department of Health and Human Services.